And now I open the floor for the discussion. You have the list. Now, since group statements will be taken first, so the first, I'll give the floor firstly to Czechia on behalf of the EU and its member states, preceded by Israel. The Czech Republic, please.
Honorable Chair, Distinguished Director General, Regional Director, Excellencies, colleagues, I have the honor of speaking on behalf of the European Union and its member states. We would like to start with commending the WHO leadership and the strong and timely regional response while collectively facing simultaneous and complex emergencies with consequences exceeding our region. We are being reminded of our core shared values and the essence of the European Programme of Work. This spring, 43 member states of the region, including all EU member states, came together in a historic call for a special session of the Regional Committee and condemned in the strongest terms Russia's military aggression against Ukraine in a resolution. Russia's unprovoked, unjustified, and illegal war of aggression against Ukraine, which grossly violates international law and the UN Charter and undermines international security and stability, has continued already more than 6 months. An estimated 15 million, one-third of the country's population, have been forced to leave their homes and families. Many seek refuge in our countries. Attacks on healthcare reached a catastrophic number totaling more than 500, resulting in at least 100 deaths and 129 injuries, and huge disruption to health services across Ukraine limits access to healthcare for those most in need. The EU and its member states express full solidarity with Ukraine and the Ukrainian people. The EU demands that Russia immediately cease its military actions, withdraw all its troops from the entire territory of Ukraine, and fully respect Ukraine's territorial integrity, sovereignty, and independence within its internationally recognized borders. The EU stresses that at all times Russia must respect its responsibilities under international humanitarian law. The EU has committed to mobilizing around 5.4 billion euros to support Ukraine's overall resilience, including 880 million euros made available as part of humanitarian aid, helping civilians and securing access to basic goods and services. Over 60,000 tons of in-kind assistance have been shipped to Ukraine via the EU Civil Protection Mechanism. We are very grateful for the indispensable role of WHO in ensuring access to essential health services, including delivery of critical medical supplies, and for the accelerated focus on the reconstruction of Ukraine's health system, as well as the continuous support to health systems of refugee receiving and hosting countries, already stretched by the ongoing pandemic. Excellencies, the EPW, together with its flagship initiatives, proved to be a progressive framework that is highly relevant also in the COVID period. The EPW emphasis on healthy equity is critical. The multiple emergencies and their impacts on societies and households in Europe risk to further exacerbate health inequities. We must pay particular attention to the most vulnerable groups and persons in vulnerable situations. We would like to appeal for continued focus on equitable access to global goods for health. However, filling the gaps the pandemic revealed requires a highly complex solution. This includes full implementation and strengthening of IHR and adoption of an ambitious instrument under which we work towards multi-sectoral and more equitable pandemic prevention, preparedness, and response, complementing the IHR. The instrument is to be legally binding while also including non-legally binding elements, and it will play a vital role in the global health architecture with WHO at its center. We must collectively make sure WHO is able to deliver on its unique mandate and to the needs of member states. With this in mind, RC75 adopted the forward-looking decision on sustainable financing of the organization, and the EU and its member states are ready to tackle challenges in governance in cooperation with the Secretariat. Thank you.
Thank you, sir. I should remind you that group statements, we will give them 5 minutes, and member states, 3 minutes, so please respect the time limit. And now Israel proceeded, followed by Germany. And the speaker would be Professor Nachman Ash, Director General of the Israeli Ministry of Health. Professor Ash, please.
Thank you, Mr. President. The excellent regional director's report on the work of the WHO Europe highlights some of the most pressing health issues facing the European region and indeed the wider international community. Health emergencies caused by military conflict and outbreaks of infectious diseases spill beyond national borders. No crisis is isolated, and each one of these emergencies is of great concern to each one of us. Israel's response to the war in Ukraine included both establishing field hospitals within Ukraine and on its borders, as well as absorbing thousands of Ukrainian refugees into our health system. Similarly, having achieved the world's fastest vaccine rollout and established advanced monitoring mechanism to combat COVID-19, Israel is committed to working with its international partners in disseminating vaccines and advising on pandemic responses. Israel also greatly values the mutual work in tracking other emerging viral threats such as poliovirus and monkeypox, and recognizes the importance of identifying lessons and applying them to our practices as our best course of action. We are also partway through the European Program of Work for 2020-2025, during which time great progress has been made on a number of core issues. This includes digital health, a field in which Israel is pioneering, embracing modern technologies, and working with a wide array of stakeholders. Looking ahead to implementation, Israel is proud to be establishing the WHO Digital Health Center for the benefit of the whole region. Moreover, the report emphasizes on healthcare that is both sustainable and holistic is an essential reminder on the importance of the forging patient-centric approaches in our shared efforts in combating both communicable and non-communicable diseases. Aspiring to achieve SDGs and incorporating BCI tools into our healthcare practices are crucial to accomplishing this. Speaking just now, the regional director talked about the need to adapt to the new normal by a dual track. It is incumbent on us all to do precisely this. By assessing where we have come and appreciating the long journey ahead, we can chart our course through choppy waters that lay ahead. We are all on the same ship, and we all owe to steer together to achieve high quality and equitable healthcare throughout the region and throughout the world, and be prepared to any emergency event, as said, dual track. Thank you.
Oh, okay. You respected the time almost. Thank you very much, Professor Ash, and also for me personally for this amazing job you're doing as Director General in the last year and a half. So now it's going to be Germany, followed by Luxembourg. Germany, please.
Mr. President, Mr. Vice President, dear Tedros, dear Hans, first of all, I would like to thank you all for organizing this wonderful and very important meeting which we are having here and which I'm proud to be part of. Germany obviously fully supports the statement that you have provided us with. And let me point out that we are at the brink of major changes internationally. Science is showing us the way that in the future we will have far-reaching changes in the following way. We will be challenged by more and more communicable diseases, and these diseases will change our daily life. We live in a time where communicable diseases are becoming more important. This is due to climate change, it is due to where we live, it is due to biodiversity changes, it is due to changes in the viruses themselves, it's also due to the way we live and how we travel through the world. So therefore, we will see more of what we already have, and the pandemic, the COVID pandemic is far from over. We are already seeing monkeypox, we are already seeing polio, we will see much more. So if we will be able to face these challenges, we have to take these challenges seriously, and we have to look at these challenges as being the sign of more challenges to come and not, let's say, an interim situation. And we also have to look at the causes of these challenges. Number two, we will also have more heat problems. We will have more drought, we will have more heat waves, we will have more heat shocks, we will have more people dying directly from heat. And we have to take climate change more seriously. We have to start to regard climate change as something that is a public health issue. And therefore, reducing CO2 emissions is a public health obligation. It is not something that we do in order to have a better world, but it is something we have to do in order to make this world more safe. And we have to take into consideration that it is the richer nations that cause the CO2 emissions, and it is the poorer nations which typically suffer from this. So we have to live up to this obligation. Finally, we also have to face that there is war coming across, and no one here would have expected to have a war in Europe. Therefore, obviously, Germany condemns the brutal, violent attack on the people of Ukraine, and we do whatever we can in order to help the Ukrainian people to get through this war. But we have to take wars more seriously, and wars are a public health threat. Millions of people have been forced to move. Millions of more people will have to move in the future. The entire healthcare structure in the Ukraine is at risk currently, and we have to rebuild this. So this will take decades, and therefore let me finish in pointing out that we all have to condemn Russia's aggressive attack here, and the three challenges that I have pointed out are challenges that we will only be able to meet if WHO carries out its work, and in order to be able to do this, WHO needs more money on a regional level, but also on a global level. So Germany calls upon the regional members here that we have to support WHO, because we all depend on WHO, and it is a very good investment for which we all stand.
Thank you very much, Professor Lauterbach. On behalf of Germany, it's a pleasure to have you here. Now I give the floor to Luxembourg, followed by Armenia. Luxembourg, please.
Monsieur le directeur général, monsieur le directeur régional, Excellences, chers collègues, le Luxembourg s'associe pleinement à la déclaration prononcée par l'Union européenne au nom de ses 27 États membres. La santé mondiale se voit confrontée à de multiples crises. D'abord la pandémie Covid-19, qui est toujours en cours et dont les défis sont nombreux, notamment l'incertitude quant à l'évolution de la situation, la fatigue des gens et les taux stagnants de vaccination, tout ceci aujourd'hui dans un contexte très tendu sur le plan économique. S'ajoute une nouvelle urgence de santé publique de portée internationale, en l'occurrence la variole du singe. Je saisis ici l'occasion pour féliciter l'OMS, notamment de ses efforts de communication qui portent déjà leurs fruits sous forme d'une constante diminution des cas d'infection. Je voudrais également exprimer ma solidarité avec l'Ukraine et ses citoyens et citoyennes. Les attaques sur des infrastructures de santé sont particulièrement déconcertantes. Il est humainement inacceptable que des civils y laissent la vie. En tant que ministre de la Santé, j'estime qu'il est de notre devoir de soutenir l'Ukraine dans ses efforts de maintenir son système de santé opérationnel au travers de dons de matériel et de transferts de patients, mais aussi en assurant la formation du personnel de santé exilé et en mettant à disposition toute notre expertise collective, aussi en vue de la reconstruction. Le Luxembourg réaffirme son engagement pour soutenir l'Ukraine et les pays avoisinants et je profite également de l'occasion pour les remercier de leurs efforts. L'OMS et son bureau régional jouent un rôle crucial pour venir en aide aux civils, notamment en assurant l'accès aux services de santé essentiels. Conflits, crise sanitaire, violation des droits de l'accès à la santé, notre génération et les futures générations en souffrent plus que jamais d'un état de santé mentale fragilisé. Nous devons donc veiller à ce que les besoins en matière de santé mentale soient pris en compte quand des stratégies liées à la santé ou aux droits humains sont élaborées ou mises à jour. Je voudrais ici aussi mentionner la santé sexuelle et reproductive et les droits qui y sont liés. Malheureusement, des pas en arrière ont été faits à l'échelle mondiale et nous devons donner des signaux clairs pour renforcer les droits des femmes de décider de leur corps. Je voudrais par ailleurs féliciter l'OMS pour les progrès dans la réforme de l'architecture institutionnelle et je me réjouis particulièrement du consensus obtenu pour rendre les traités pandémie juridiquement contraignants. En ce qui concerne la révision du règlement sanitaire international, la transparence est un élément crucial, ainsi qu'une communication efficace et une responsabilité renforcée. Permettez-moi enfin de mentionner les évolutions récentes concernant le financement durable et de réaffirmer l'engagement du Luxembourg de continuer ces discussions afin que l'OMS soit entièrement financée par des fonds flexibles et multiannuels. Cela nous permettra de pouvoir répondre rapidement aux urgences sanitaires y inclut celles qui émergent de situations de conflit et de catastrophes naturelles. En dernier lieu, je voudrais remercier l'équipe Migration et Santé de l'OMS qui a fait un travail essentiel pour sauvegarder les droits et impliquer surtout davantage aussi les personnes les plus vulnérables. Je vous remercie de votre attention.
Merci, Madame. Et là maintenant, the next speaker would be Armenia, followed by Tajikistan. Armenia, please.
Thank you, Mr. President, Honorable Dr. Tedros, Honorable Dr. Kluge. It's a pleasure to take part in the 72nd session of WHO RC for Europe. With our agendas shifted after the COVID-19 pandemic, a great opportunity to regain a better understanding of the overall picture and draw our attention back to the issues that have been neglected for a while. And thank you very much, Dr. Kluge, for an important message envoyed today, dual tracking, which we'll take with us. Although the pandemic has receded to an extent, it still remains an emergency, which needs our attention and resources. I want to thank all partner countries and organizations for their invaluable support throughout the past 2 years in delivering essential and life-saving COVID-19 vaccines. Witnessing a pandemic and the 44th day of war of 2020 unleashed by Azerbaijan against the people of Nagorno-Karabakh, we have received huge support from international colleagues in receiving emergency medical teams and various medical equipment and supplies. What these challenges came to teach us is that our systems need to be better prepared for such emergencies, and the emergency preparedness and response has to be a key priority for the health systems of all countries. As the saying goes, safety first is safety always, which is why a systematic approach should be adopted by all countries in this aspect. It's now our duty to adapt the ever-changing context of health emergency operations and maintains its relevance to disasters and health-related emergencies that remain as frequent, severe, and complex as ever. Therefore, it is my pleasure to invite you to the 5th WHO Global Emergency Medical Teams meeting, which will take place in Armenia from 5 to 7 October this year. Following postpones due to COVID-19 pandemic, this initiative is essential for diverse community of EMT providers, member states, and network partners to review that has been accomplished in recent years, build on lessons learned and best practices, aiming at fostering collaborations of those involved in EMT search response through providing a platform for the development of EMT global strategy. I look forward to hosting you all in Yerevan in October for this important global event. Finally, I would like to wish everyone success to the 72nd RC, and thank you very much. Thank you, Israel, for hosting us.
Thank you, Armenia, and welcome. Now it will be Tajikistan, followed by Denmark. Please, Tajikistan.
Уважаемый генеральный директор, уважаемый региональный директор, уважаемый председатель, уважаемые участники 72-й сессии Европейского регионального комитета. Пандемия COVID-19 показала слабые стороны наших систем здравоохранения, проанализировав которые в будущем мы сможем избежать допущенных ошибок. Именно в Республике Таджикистан в период пандемии COVID-19 первичная медико-санитарная помощь показала свою ценность, и, как отметил доктор Ханс Клуге, мы были обязаны с самого начала адаптироваться к условиям новой нормальности. Несмотря на давление, вызванное пандемией COVID-19 и огромную нагрузку на медицинских работников, Таджикистан была привержена европейской программе работы на период 2020-2025 годов и руководстве национальной стратегии республики на период до 2030 года разработали и утвердили новую национальную программу по охране здоровья населения. Таджикистан усердно работает над достижением всеобщего охвата услугами здравоохранения по мере достижения цели устойчивого развития с 2020 года возрос на 60%. Мы особенно гордимся нашими достижениями в области вакцинации детей и реагирования на вспышки заболеваний. Уровень доступности всех плановых вакцин составляет 94%. 20 лет назад около 17 детей не имели возможность получить прививку. А к 2020 году нам удалось увеличить этот охват до 97% от общего числа всех детей. Мы действительно преуспели в борьбе с полиомиелитом. На сегодняшний день мы являемся страной, повторно подтвердившей сертификат свободы в стране от полиомиелита. Эта практика помогла нам с планомерным разделением вакцин во время пандемии COVID-19, так как мы стали второй страной в европейском регионе, получившей вакцину COVID-19 через механизм COVAX. Благодаря некоторым двухсторонним договоренностям и усилиями правительства Таджикистана,
the government of Turkmenistan was able to reach 93% of the population to a third dose. The entire sub-region is still faced with the TB problem. With our partners and the WHO, we are working on this issue. The Healthcare Ministry adopted a national program against TB, thanks to which we have increased access to treatment against TB, including that has antimicrobial resistance. I want to thank once again the WHO and all partners on development for their collaboration and their support in these difficult times. Thank you.
Спасибо большое. Thank you very much. We will have 3 more member states till the lunch break. So now it will be Denmark, then Norway and Slovenia. Denmark, please.
Thank you, Chair. DG Tedros, RG Hans, Excellencies, colleagues, Denmark aligns itself with the statement made by the Czech Republic on behalf of the EU and its member states. Denmark also thanks Israel and the regional office for the extensive work in planning this regional committee meeting here in Tel Aviv. War, COVID-19, monkeypox, and polio are all examples of what is currently challenging our region. We believe that this makes multilateral cooperation even more important than ever before. Russia's illegal and unprovoked invasion of Ukraine affects us all. War and conflict have fatal consequences on health. In addition to the many direct victims of the war, we see the destruction of hospitals, disruptions of access to healthcare services and to preventive measures for illnesses that are treatable and preventable under normal circumstances. We see also serious trauma and increased mental health issues, just to mention a few consequences of war. Denmark remains highly committed to supporting the people of Ukraine. The war in Ukraine is first and foremost an attack on the Ukrainian people, but it is also an attack on our region's ability to cooperate. We saw the results during the World Health Assembly in May that clearly demonstrated the current disagreements and divisions within our region. We have to remind ourselves of our common goal, the essence of the European program of work, to protect against health emergencies, to promote health and well-being, and to work towards universal health coverage. After 3 years of handling a pandemic, the consequences of our healthcare systems are significant. We all see increasing waiting lists in our hospitals, and we experience shortages of healthcare professionals. While the last 3 years have been almost entirely about emergency responses, the coming years have to be about reaching a new level of health protection. A situation where all countries in the region are prepared for the next health crisis with an alert to emergencies, but where we can also strive for the constant improvement of health for all. Our hope for the future can quickly be replaced with sadness and worry. I look forward to our discussions in the coming days and hope for a meeting characterized by fruitful and productive results. Thank you, Chair.
Thank you very much, and thank you again for hosting us in Copenhagen just shortly. So now it will be Norway, then Slovenia, then Belgium, and then the lunch break. So Norway, please.
President, Director General, Regional Director, Excellencies, colleagues, I would like to thank the government of Israel for their hospitality and the regional office for their dedication to improving health in the region. While I'm pleased to meet with colleagues from the entire region, I wish we could have met under different circumstances. Words cannot describe the suffering caused by Russia's unprovoked and illegal invasion of Ukraine. Ukraine and Ukrainians have Norway's full and unwavering support. We condemn Russia's aggression, we condemn deliberate attacks on civilians, on healthcare facilities and health workers. And we demand respect for and protection of civilians and civilian infrastructure, including those sick and wounded, health personnel and health facilities. I am encouraged to see that WHO's activities continue despite the war. In May, the Assembly agreed to negotiate the pandemic treaty, strengthen the international health regulations, and bring WHO's financing on a path towards sustainability. I'm also encouraged by WHO's capacity for managing humanitarian health crisis. Norway will continue our support for these crucial aspects of the WHO mandate. While some parts of the region are now emerging from the grip of the pandemic, other parts are still struggling. In addition, we are faced with emerging and re-emerging viral threats such as monkeypox and polio virus. The containment of these outbreaks and strengthening vaccination capacity integrated in primary healthcare is essential. The new normal must be a dual track forward, as precisely expressed by our regional director. A top priority for my government is to expand access to novel high-priced medicines. We see great innovative medicines coming to market, but too few patients can enjoy the benefits. Norway and WHO Europe have over the last 2 years been collaborating on the Oslo Medicines Initiative to facilitate the discussion with the industry and other stakeholders to find concrete solutions for better access to new medicines for more patients. Expanding access to new medicines is a burning issue, but also one where momentum is picking up due to rising inflation, shrinking health budgets, pipelines with new high-cost personalized medicines, and the identification of concrete solutions for change has inspired action. I'm looking forward to forward discussion with your colleagues on our OMI lunch. Thank you.
Can speakers please send in their statements to the interpreters?
Thank you very much, Norway. Now we'll move to Slovenia and then Belgium. Slovenia, please.
No? Thank you, Chair. Dear Director General, dear Regional Director, Slovenia aligns itself with the statement made by Czech Republic on behalf of the European Union. On behalf of Slovenia, I would like to express my utmost appreciation for the work of the Regional Director during the very difficult period. Unfortunately, this is our new reality. COVID-19 pandemic still goes on, it will go on. We have the outbreaks of monkeypox and poliovirus, and unfortunately, we have the catastrophe in Ukraine due to war caused by Russians. Still going on, we have several crises that are waiting around the corner, and we need to be prepared for all these crises. Dr. Kluge, during the worst health crisis in the history in our region, you remained our point, and of course, Slovenia put it, like you said, the primary health care, the emergency preparedness, the digitalization on the top of our priority list of the new government. But let me share with you some challenges that we are facing, and only with the regional solidarity we would be able to go through it. Our decisions must be evidence-based statement. This is the only way and the only tool that we need to address all the fake news in the social medias. Maybe we lost trust. The people trust due to all this social media, and this is a must for us. We have to address this, maybe not a dual, but a trivial way to add this, because it's causing really, really damage. People don't trust anymore in evidence-based statement. At the end, the World Health Organization is an important partner to us, and that is why we need to ensure it remains independent and true to science. Of course, the member states must secure sustainable financing. Let me finish that Slovenia stands ready to support regional and international collaboration based on solidarity. And of course, dear Regional Director, we support you for all your future work, and we hope that the war in Ukraine stops as soon as possible. Thank you.
Thank you very much, Slovenia. And now the last country before lunch would be Belgium, please.
Monsieur le Président, Monsieur le Directeur Général, Monsieur le Directeur Régional, Excellences, chers collègues, la Belgique soutient la déclaration qui a été prononcée précédemment par la Tchéquie au nom de l'Union européenne et de ses États membres. Nous remercions le Directeur Général et le Directeur Régional pour leur engagement continu au service de la santé de toutes et de tous. Comme l'a dit dans son rapport le Dr. Hans Kluge,
as Hans Kluge said in his report, we are going through troubled times. As a consequence, today more than ever, we need the WHO to guide us in the face of great healthcare issues such as prevention, preparation and response to future pandemics, antimicrobial resistance, or the consequences, the healthcare consequences of climate breakdown and the environmental consequences. We are convinced of the importance of multilateralism. That is why Belgium has been actively involved in the elaboration of a collaboration strategy between the WHO Regional Office and its member states, a strategy which will be presented for adoption at this committee. That's also why our country welcomes this week the Ukrainian delegation to exchange among experts questions related to mental health and thus supporting ourselves among peers in these troubled times. Director General, Regional Director, our countries are still responding to the long-term consequences of the COVID-19 pandemic, and the WHO must support the resilience of the region. And on this, I want to focus on 3 lessons learned from the pandemic, for which we expect from the WHO a key role. First of all, the pandemic underlined the importance of a resilient healthcare system, and this will require extra investment and particularly a contingency reserve of healthcare staff. Secondly, we need to ensure the accessibility of healthcare, and that's a key part of healthcare systems' resilience. The price crisis that we are going through underlines the issue of the cost of healthcare. And thirdly, the COVID-19 pandemic showed us that a healthy population is also a resilient population. And now we need to understand the importance of preventing NCDs. Dr. Kruger, this regional committee marks the end of Belgium's office at the Standing Committee. It's been an honor to collaborate with you, and we wish you all the best for the future. And I want to thank also Israel for welcoming this committee. Thank you.
Monsieur.
Thank you very much.
So now, before we go for the parallel sessions during the lunch break, I would ask the Executive Director, Rob Butler, to make some household remarks, please.
Thanks very much, Chair. So we're releasing you now until 3 o'clock. The ministerial lunch will take place immediately, the ministerial lunch on the Oslo Medicines Initiative. That's in King Solomon C room, and I believe you can have this it's all online in the program. I believe the details are here, so I don't even have to list them. Super. For the parallel sessions, these will start at 1:45, and that lunch will be served next to the session rooms. The informal consultation on conference documents that the Chair referred to earlier will be held at the same time at 1:45 in the plenary hall, so here. The same Zoom links will be applied, but observers are asked to leave the room for this period and join us back here at 3 p.m. I understand that lunch is served, if I'm not mistaken, on the Grand Ballroom Terrace. The doors at the end there, as you can see, that they've opened, and that you are welcome to help yourself to lunch immediately. So we have a 2-hour break now. We return to plenary at 3 o'clock. And again, I very much urge you to be back in time, and thank you for the morning session.